Welcome to Environmental Concerns, sponsored by Breathe California, the lung health organization for the state of California. We're a nonprofit and I'm a volunteer. Today we're talking to Vivian Chang, who's an asthma expert on Breathe California's website, which is under my name. You can get answers or background about 13 different types of lung disorders, such as asthma. But asthma is really prevalent. An incredible number of young people get it. And Vivian's going to explain more to us in 30 seconds.
My name is Rene Montez. I've been using the CPAP machine, I would guess 10 years. I got so accustomed to it, I don't go anywhere without it. I take it with me everywhere. From the moment I put it on, I thought it was the greatest thing because the breathing was a lot easier, and after using it for a couple nights, I felt a lot of energy. Breathe California is fabulous.
Welcome back. I'm Terry Trumbull. We've been doing this TV show once a week for 34 years. If you see something you like about it or you want to help, just call 408-998-5865 and we'd be happy to have you volunteer. We've assisted about 200,000 people in some years, and that's all because we've had a lot of volunteers volunteering to help out. So, Vivian, you're working for Breathe California as an asthma expert. Is that the way we ought to describe you, or how do you want to be referred to?
Yeah, that's our unofficial title, I guess, but my official title at Breathe is the Health Education and Community Outreach Specialist.
Well, I can see why expert's a better title just because it's shorter. So, talk a little bit how you got here. What kind of
Yeah.
background do you have to be in this position?
Yeah, well, hi Terry. Thanks for having me on the show. Like you said, my name is Vivian Chang. Again, I'm the Health Education and Community Outreach Specialist here at Breathe California. I work primarily in the asthma program, the tobacco control and prevention program, and the community health programs here at Breathe California. My background is in global health and public health. I spent my undergraduate years at UC San Diego until I had to move back home for a little bit because of the pandemic, which ended up being unintentionally a really good thing because I was able to do an internship at Breathe California while I was back in San Jose during my third year of college. So yeah, I was one of the asthma interns working with Kieran around 4 years ago. Then I went back to San Diego to finish up my bachelor's, and then I moved up to San Francisco to work on my graduate degree at UCSF. I graduated with my master's in global health sciences in summer of 23, and I always had an interest in chronic diseases and the disparities of outcomes that happen for minority groups. So asthma was the sweet spot that I had, and I had a great experience at Breathe. So I was glad to come back to Breathe full time as one of the asthma health educators after graduating from UCSF. So yeah, here I am a year and a half later, still working in the asthma program as one of the asthma health educators. And since I started at Breathe, I have picked up a few more roles in the organization, including the community outreach specialist role, helping coordinate interns for health fairs, making sure that we are getting out there and putting our mission out there to help community members promote healthy lungs and lead healthier lives. I also provide health education and help coordinate events within our tobacco control and prevention program, including giving Vaping 101 presentations to students at schools, hosting the poster contest that we had last summer, and also helping with Youth for Lungs events. Yeah, and it's been a pleasure to be working with so many subgroups of our community in different capacities, whether it's doing asthma remediation visits at different patient homes or doing an indoor air quality assessment for senior community members or health screenings or working with students to make our approach to public health more fun and cool for them. And it's also been a really great privilege to see how our asthma program has grown since I first got involved with Breathe back in 2021, which was around 4 years ago. So in that time, it was just Kieran and Dolores doing home visits, mostly on the state grant that we had from California. And then when I joined in 2023 full time, we were on the tail end of that grant, transitioning to doing contracts with Medi-Cal plans. And we were just entering our first one in 2023. And now we're on our sixth contracts with six different counties, and we're the primary asthma prevention and remediation community supports provider for these counties. So it's been really rewarding to see this growth, but also help foster some of it as well.
Well, I started out mentioning a need for volunteers. I'm a volunteer and probably done 7 or 8 health fairs myself and had 50 to 60 interns from when I was a full-time environmental studies professor, and health fairs were a lot of what they do. Why don't you tell us what a health fair is and how easy it is to sit at a desk and pass along information on that?
Yeah, I always say that every health fair is a really fun and unique experience. You never know what to expect. And because public health, a large part of it is being able to connect with community members and speak to them and just hear what they need and connecting them to the right resources. I always tell our interns that you should just always be there to listen and know what programs we have and be informed about what our resources are so that they can connect people to the right resources that they need. Health fairs are a wide range of different type of events. We call them all health fairs because we're a health organization, but sometimes we'll be at like corporate events, we'll be at universities, we'll be at senior centers, cultural centers, places like that where people might not go there to hear about lung health, but they'll leave with like a brochure from Breathe and new knowledge that they didn't have before.
So a couple of my interns got hired full-time like you did after working as interns. One was running the energy program that Pete Christensen does now. Pete is excellent in trying to work to get us off of fossil fuels, which are creating our biggest health problem on Earth, which is climate change. So why don't you talk about what is asthma? Almost everybody's heard the term, but I'm not sure most of our audience knows what it is.
Yeah, that's a really good question. So, asthma is a chronic lung disease that is one of the most common chronic diseases that we see in children in the United States. I think currently almost 28 million people, and this includes children and adults in the US, have asthma, which is about 1 in 12 people. We know that asthma is the leading cause of hospitalization and missed days of school for children. And we also know that children with asthma who are in racial and ethnic minority groups are the most impacted by this. Asthma is a chronic disease, which means that when someone has asthma, they do have it for life. But many people with asthma are able to live really normal lives with minimal interruptions from the condition if they're able to avoid their triggers, take their medications as prescribed, and if they are aware of which warning signs to look for within themselves to know when to take action and know how to stop an asthma episode before it gets worse. So, the basics of asthma, when a person with asthma encounters a trigger, and this can be anything from dust to cold air to stress to exercise, there are three things
Is
that
pollen one
happen.
of those?
Yeah, it can be. Yeah, that's a really common one. But yeah, triggers are everywhere. Everyone has different triggers, and they can react differently to different ones as well. But when someone does encounter a trigger, there are three things that happen within their airways that can cause them to have symptoms. I actually have my little diagram here that I use for asthma visits. So the first thing that happens during an asthma episode is that the muscles in the airway they tighten and pinch down. The second is that the lining of the airway itself starts to swell because of the inflammation. And then the third is that there's excess mucus production as well inside the airways because of the reaction to the trigger. So you'll see that the opening for air is that tiny area there compared to what it looks like in a normal airway. So that opening is a lot wider, a lot bigger. So air is like passing way easily through the airways in a non-asthmatic airway. And because of the smaller airway in people with asthma, they describe it as trying to breathe through a straw, which is why we see a lot of the symptoms that we do see, like coughing, wheezing, chest tightness, shortness of breath, difficulty breathing. And because breathing is so important to the functions of the entire body, even though asthma primarily happens in the lungs, people do feel the impacts of it throughout their entire body. So yeah.
So, a few years ago, I don't know if it's current statistic, but less than 5 years ago, I'd heard that 25% of the students in San Jose elementary schools needed to have inhalers. Tell us what an inhaler is. You've done a great job setting it up with that with that show and tell that you just gave us. But
I have another show and tell item. I actually have an inhaler here.
good.
So, inhaler
So
is,
go
okay, go ahead.
ahead.
Yeah, an
What are we
inhaler
using
is
for?
one of the ways that asthma medication is administered. It's one of the most common ways, actually. And there are different types of medications, different types of inhalers, but the most common one is this aerosol one here. And one of the most common asthma medications is albuterol, which is a short-term medication used as needed for different symptoms that pop up throughout the day. But yeah, it's like a little canister that you insert into this device and you just shake it, prime it, and just pop it in and breathe it.
So my impression is inhalers are for emergencies. They're not general health um, uses for inhalers.
Yes, that's a really common misconception that we see a lot. So there are different types of medications. What we're trying to do now is trying to get people to recognize the different type of medications they're prescribed. So many people with asthma, they are prescribed what we call a maintenance medication that they take every single day, sort of like a preventative measure. So they'll do like one puff in the morning, one puff at night. And this can be like Symbicort, Qvair, medications like that. That's like every day, like on schedule. You should take it every single day, twice a day. And then many people do have a supplemental inhaler that's as needed. So that would be the albuterol, commonly we see, and some people even have a nebulizer for that too.
So Vivian and I are going to be back in 30 seconds to talk about who does Breathe California's asthma program serve and what sort of services they offer. But first, we're going to have a public service announcement from Breathe California about one of their other programs. Back in 30 seconds.
The different therapeutic methods that we can help our very low socioeconomic status clients who have no alternatives, no anything, and there's still about 15 different resources we got out of this that if you have no resources, no service connection, you can still get aid.
That they are connected, one encourages the other, and that the process of change from backing off from the tobacco is the same as backing off from any other addictive drug.
Everyone can benefit from this training that we just were offered today.
Welcome back. I'm Terry Trumbull, a volunteer for Breathe California, and we're talking with staffer Vivian Chang about asthma. Why don't you talk about what kind of things your asthma program serves?
Yes, so our asthma program, we are a community supports provider for Medi-Cal patients in Santa Clara, San Francisco, San Mateo, and Contra Costa counties, as well as the counties in the Central Coast. So this benefit is mostly geared toward patients of all ages with severe or uncontrolled asthma, or who have had an emergency department in the past year due to their asthma symptoms. And something exciting for this year is that we have new funding that will allow us to serve more asthma patients who reside in our service areas and are in need of asthma remediation services, but who might not be insured under one of our contracted Medi-Cal plans. So because we strive to be as accessible as possible of a resource, we are really glad to be able to expand our reach and to be able to serve as many community members as we can. And then besides that, our more general asthma services like presentations and workshops can be for anyone from parents, schools, daycare providers, other community organizations. Yeah, so we serve anyone who has asthma or anyone who interacts or cares for somebody else who has asthma.
So, how do they get that program at their school or group?
Yeah, all they have to do is just reach out to either Kieran or I. My email is vivian@lungsarrest.org. Just email us, let us know what type of information you want us to give and how long the presentation would be, and we're happy to go out there.
Or you can give Vivian a call at the same number I gave earlier, 408-998-5865. And I'm sure she'd be happy to talk to you because she probably doesn't get more than 7,000 phone calls a day. What else do you want to talk about in Breathe California's asthma program?
Yeah, I would love to give just an overview of what the asthma remediation program can offer. So patients in our asthma remediation program receive one-on-one care from one of the asthma health educators in our team, and we're a pretty small team. So this is either going to be me, Kieran, or Dolores, or Yvonne. We will meet with each individual patient to provide education to help identify their symptoms, their triggers, provide guidance on how to use different medications, like the inhaler demo I just gave, and what each medication is meant for. We do try to fill that gap and help answer any questions the patient might have so that they're better equipped to manage their symptoms in their daily life. And then after we do the education portion, we do have an in-home environmental assessment with the patient where we do a walkthrough of their home to identify different triggers that might be present in their home environment. We'll offer tips to help mitigate some of these risks, and we also are able to provide equipment like an air purifier or a HEPA filtered vacuum or cleaning supplies, whatever they need to help foster a home environment that is more asthma friendly for them. And then on the other side of things, for schools, daycare centers, other organizations, we can provide asthma 101 presentations and asthma management workshops as one of our free resources. So we'll cover what the basics of asthma are, how it affects the body, the symptoms, the triggers, the warning signs. We'll do demonstrations. And because asthma is one of the most common chronic diseases in children that we see in the US, like I mentioned earlier, the coordinated care between the parent, the doctor, the teachers, anyone who spends a lot of time with children with asthma is really important. So that's why we're always happy to get out there to a school and give these presentations just so we can help provide that education about asthma and make sure everyone is prepared to care for someone with asthma.
So I asked you about pollen earlier because on the way here from back from lunch, KCBS announced that this is the major pollination season. And so I thought that probably was going to convert into asthma. What other environmental factors cause problems? We have had lots of fires in the Santa Cruz Mountains in both of the counties, northern Santa Cruz and on the border with Santa Cruz in Santa Clara County, and a lithium battery fire that burned for 4 days because the fire people couldn't figure out how to put it out. I assume those are triggers that you were talking about earlier.
Yes, that is exactly right. Yeah, there are many, many different types of environmental triggers for people with asthma, like you mentioned, from pollen, dust, fires, other air pollutants in the air that can cause issues for people with asthma and can cause a flare-up or an asthma attack to happen. And a lot of the time, these environmental risks are out of the person's control. Like they might live near a really busy road with tons of traffic, tons of pollution from cars. They might be unlucky enough to be near one of the fires that you mentioned. They might live in an older home. They might live in the desert where the air is super dry. So even though it's pretty impossible for a person to avoid these triggers 100%, we still like to emphasize the importance of people knowing exactly what their triggers are when they do have asthma so that they can try their best to avoid them. And you mentioned the fires. I think everyone has heard of the devastating fires that happened in Southern California and the smoke that affected millions of people. That's one of the major concerns in California that comes up every single year, and it will keep coming up because of climate change. So we always want to get that information out there on how to maintain good air quality within someone's home and what to avoid while these events are happening, because smoke inhalation can cause irritation in the eyes and inflammation in the respiratory tracts, and this can lead to symptoms like increased coughing, wheezing, mucus production, difficulty breathing, for anyone, but especially for people with respiratory conditions like COPD, lung cancer, and asthma. And these people are the people who are most vulnerable in these situations. So yeah, when those things are happening, we really recommend using an air purifier with a HEPA filter to ensure that air quality inside their homes are as safe as possible. Yeah, there are many types of air purifiers out there, but just look for one with a HEPA filter, since they have been shown to be highly effective. So yeah, you can be vigilant when wildfires are happening, when pollen count is high. You can check that on the weather app on your phone. We always tell our patients to stay inside with the windows closed and with the air purifier on when these things are happening, just to make sure that you're breathing the best quality air as you can.
So if you have to go outside, should we dig up our old COVID masks and wear them?
Yes.
So this is not what you expected, but Breathe California provides a wide variety of services, and one is they helped me with is CPAP. Are you familiar with that is what that is?
Yes. Everyone in the office kind of helps out with the CPAP stuff, so we're kind of versed with that too.
So why don't you explain what it is?
Yeah, so we have a program called the Sleep Safe CPAP program here at Breathe California, where we get donations of lightly used and even new CPAP machines from organizations like Kaiser or from different individuals who might have gotten a machine and they found out that they didn't need it or they needed a different one. So that machine would otherwise go to waste. But we take those donations in, we get them cleaned out. We get them ready for the next patient to use, which not a lot of people can do because it is a medical device. So we're happy to make sure that each device gets its use and is helpful to somebody else. But we allow patients to get these machines from us for around like $150 to $300, which is a lot less than what they run for brand new on the market. So we're happy to connect as many people as needed to CPAP machines that they need if they have sleep apnea.
So is CPAP similar to asthma? Is something causes the airway to tighten up? Why is your normal breathing not adequate?
That's a good question for Petra, who is our CPAP program coordinator. I know that sleep
Tell her
apnea
she's got to be
affects.
on next month's show.
Okay, good. Yeah, stay tuned for next time.
So I don't know what public service announcements were run, but Breathe California has a wide variety of programs. One of which is we're very proud of is Camp Super Stuff. What in the heck is that?
Camp Super Stuff is a free week-long camp that Breathe California hosts every year for kids with asthma ages 6 to 12. We have it every single year, and it was in a hybrid format for a couple years because of COVID, but last year was the first time in a while that we had it fully in person. And Camp Super Stuff is just a really special experience. It's the chance for children with asthma to come together and learn about the condition as well as how to manage it. We do try to make it really fun, so it feels like a real summer camp, and the kids have a great time while also learning important information that they'll use every single day in their daily lives. Like last year, we were able to incorporate slime making, yoga, duck therapy, swimming, ice skating, a trip to Calibunga, the water park. And we've seen that because everyone at camp has asthma. It's always a super special experience that allows the kids to bond, learn from each other, and have that peer support that they might not get like at school with their friends. So yeah, our goal is to have every camper leave camp feeling empowered and that they are in charge of their asthma.
So
And
go ahead. You're accepting um, applications to be in it from parents at this point?
yeah. So, registration for Camp Super Stuff 2025 is now open. It will be taking place at the Mayfair Community Center in San Jose from July 28th to August 1st. And we are taking campers on a first come, first served basis from Santa Clara Family Health Plan and also Valley Health Plan. We have 25 spots and we have the application ready. So, if anybody's interested, please email Kieran or I, or you can find it on our website as well if anyone's interested in sending their child to camp.
So finally, before your wrap up is how does Breathe California help? What kind of things can they do for people with breathing difficulties?
Yeah, so Breathe California, we do a lot of different things that can help. We always emphasize the importance of health education so that community members have the tools and knowledge they need to make important decisions and take their health into their own hands. And we always go back to education in all of our programs, from the CPAP program, the tobacco prevention program, the asthma program, the senior health and wellness program. So we always want to emphasize, just if you need information, if you need resources, if you have a question about any lung condition, we're always here to help. We're always here with the answers. So just reach out. And we always encourage our members to utilize what we have because all of our services are either no cost or low cost. So anyone out there who needs anything regarding lung health, we are here and happy to help.
My recollection is that you've got brochures in your office for like 8 different languages.
Yeah, we have like everything, pneumonia, influenza, lung cancer. We have them in Vietnamese, English, Spanish, Korean. Yeah, anything you might
Chinese,
be
I
interested
assume.
in, we'll have it.
So is COVID one of those brochures that you have or you have information on the website?
Yes, we have information on the website, and I have seen a couple brochures we have about COVID too. So yeah, again, anything you need, we have it probably.
So we got 30 seconds or so left. What's your summary of all these goodies that you've tossed in front of us?
Yeah, just to summarize, Breathe California, our asthma team is always here to help. So if anyone has any questions about asthma, about air quality, or even outside of those things like CPAP, questions about tobacco use, questions about vaping, if you need advocacy, we are here to help. You can always reach out to a member of the Breathe California team, and we will do our best to help you. All of our resources and our contact information is available online at lungsorus.org. Thank you.
Thank you, Vivian. We appreciate it and glad your internship turned into a good job.
Yeah,
So thanks again and tell Petra to get ready for March.
I will.